Good evening to all. How are you all? कैसे हो सब? सब ठीक है?
अच्छे हैं सर.
Very good.
Yes sir.
Very good. Again, very happy to see you all for today's session. So, in the previous class, we have seen about mental retardation. याद है ना? Mental retardation. So, mental retardation कितना type होता? 4 type: mild, moderate, severe, profound. So, in today's class, we are starting with the causes of mental retardation. So basically, there are 3 types of causes. First one is prenatal or biological cause. Second one is perinatal, and third is postnatal. Postnatal cause includes the environmental cause also. Now let's see the causes one by one. First one is prenatal cause, that is before birth. So what is happening in the prenatal cause? Some of the genetic abnormalities, chromosomal disorders, plays a significant role in the cause of mental retardation. For example, trisomy 21, otherwise it is called Down syndrome, Klinefelter syndrome, Fragile X syndrome, Prader-Willi syndrome, phenylketonuria, PKU. Main cause for mental retardation is phenylketonuria and Williams syndrome. These are the common prenatal cause for the mental retardation. The second one which you want to know is the perinatal cause during birth. So during birth, intrauterine stage, there are some kind of problem can occur during the time of delivery. For example, birth injury can occur. So that birth injury can cause mental retardation. Abnormal presentation. So in OBG you are studying the text presentation, the breech presentation. So the breech presentation or any other abnormal presentation can also leads to mental retardation. And umbilical cord problems. Umbilical cord, if there is any very short umbilical cord, or if the umbilical cord ties around the neck of the baby, that may also leads to mental retardation. Sometimes when the mother is having multiple gestation, carrying more than one baby in a time. In case of twins or triplets, quadruplets, so this is multiple birth. So during that time also, chances for getting mental retardation is very high. So birth trauma, I already told, any instrumental injury to the baby head, that also leads to mental retardation. Anoxia, during the time of delivery, if the baby is not getting adequate oxygen because of the prolonged delivery, if the baby head is not coming outside, so baby suffers hypoxia. Absence of oxygen, anoxia, can lead to decrease blood supply or cut off the blood supply to the brain. So that may also cause mental retardation. The next one is, which we want to see, is the other causes like neonatal disorders. Neonatal like hemophilia or neonatal seizure for newborn baby if epilepsy comes, or any kind of respiratory disorder, respiratory distress, and meningitis, encephalitis. Meningitis, encephalitis are major bacterial infection which is affecting the baby, that may also cause mental retardation. And head trauma, that is birth injury, that we have discussed already. So next we are going to see the postnatal cause. In the postnatal cause, the cerebral concussion or contusion or laceration because of head injury. So when we were in the OBG posting in 2005, we have seen some of the mother delivered the baby in the washroom. When the mother is going for washroom, unfortunately delivery might occur. The baby fell in the toilet. Okay. So during the time, the head might get injury, and there may be concussion, laceration, or contusion type of wound that leads the baby to poor development of mental functions, that leads to mental retardation. Infection, which I already told you, common bacterial infections like encephalitis, meningitis, malaria, German measles, and rubella are the cause for mental retardation in the postnatal period. And demyelinating disorders for example, the nerve which is having the myelin sheath. If the myelin sheath is not covered properly, that may also lead to mental retardation. And post immunization disorder. So after immunization, for example, when the vaccine, the injection is not given in the proper site because of the injury to the nerve, the baby can go to mental retardation. So these are the causes of mental retardation. So now we will see the what is the how we can prevent mental retardation. So still some other causes are there degenerative disorder. Degenerative disorders like Rett syndrome, and Huntington's disease, Parkinson's disease, seizure most commonly epilepsy, toxic metabolic disorder, these Reye syndrome, these mercury poisoning, these are all the common causes in the postnatal period. Malnutrition in Africa, you can see many children suffering from mental retardation because of this only malnutrition problem. But in India, we don't have such problem. But in slum area, it is common. Malnutrition. Poor people are not getting adequate calorie and protein-rich diet. Okay. Now let's see the environmental deprivation. Environmental deprivation like psychosocial disadvantage when there is a excessive abuse to the baby and neglect. The mother and father not want the child, just they are throwing the child in some dustbin or they are throwing in the roadside. That also can leads to mental retardation because of the neglect and any kind of chronic social sensory deprivation. Chronic social sensory deprivation when the mother is not taking the baby, when the mother is not giving feeding to the baby, when there is a lack of care, when there is lack of physical contact between the mother and the baby, that also can leads to mental retardation. So particularly the in India nowadays the most common problem for mental retardation is child abuse, physical abuse as well as sexual abuse. Now let's see the signs and symptoms of mental retardation. So mainly milestone development will be poor. The child cannot achieve the milestones in correct time, and cognitive functions will not be adequate. आपको पता है cognitive function क्या होता है? That is thinking, reasoning, judgment, learning. ये वाला function सारा abnormal है. And child deficit, there is learning deficit. We all are learning, but the child किसको mental retardation है? ABCD नहीं नहीं आवाज कम करो, आवाज कम करो. Mic, mic, mute. I think Vidhi, mic mute करो. बेटा mic mute करो, I will remove you from the group. किसको mic on करो विधि? Mic mute करो बेटा, otherwise I will remove you from the group. Okay, now come to the next thing. So in the next thing, what we want to see is the child will have difficulty in expressing the emotions. The child cannot express the emotions because the cognitive function, emotional functions are completely affected. The next thing is psychomotor skills are poor. Psychomotor skill आपको पता है, like using our hands and legs for some kind of movements to express the emotion feeling, that will be absent. and there will be difficulty in performing self-care activities. वो आपको पता है, they cannot do their personal hygienic activities. Next one is neurologic impairments are common. That is sensory impairment. Sensory, they cannot assume the pain. They cannot feel the sensations. So that is neurologic impairments. Sometimes they may not hear voices because they may be dumb or deaf. They cannot speak, and there will be another problems like irritability when frustrated or upset. Irritability, so just easily they get irritated, anxious very easily. Next one is lack of curiosity. They are not interested to learn anything. That is lack of curiosity. These are the things commonly you need to know in the signs and symptom of mental retardation. Next thing, what you want to see is the how we are going to diagnose the mental retardation. So mental retardation is diagnosed by collecting proper history. So this you want to start from the antenatal period. The mother is conceiving. During the time you need to monitor the mother and the baby properly by doing physical examination, mental status examination, by using some neurological assessment, we can diagnose the mental retardation. These things you want to do for child, okay? And milestone assessment, you want to see whether the child is standing in correct time, whether the child is sitting in correct time, whether the child is smiling in correct time. So these are the things you need to monitor. You need to observe. The next thing you want to what you need to look for is you want to know the investigation like blood urine investigation. There you can suspect for what you can suspect. There you can suspect for any phenylketonuria or any other hematological abnormalities or genetic impairment. You can do chorionic village sampling. Chorionic village sampling, that is from the umbilical cord. We collect the cells and we are going to assess. Amniocentesis, amniotic fluid analysis also can give you the idea that baby is having a normal development or not. And hear and speech evaluation done by the that is hearing that is audiologist. Audiologist can able to tell whether the sound produced by the from the environment like mother, other person, the child can able to hear or not. We can able to identify EEG. So with the help of EEG, easily we can identify any abnormal brain movements that is happened that is present in the child brain. CT scan and MRI scan can find out any injury in the brain, whether there is any kind of lesions, any kind of abnormality we can able to find. Thyroid function test can tell in the mother, we can do the thyroid function test during the antenatal period, and we can find out what will be the effect of what will be the effect in the baby. And some other psychological test already I told you in the first lecture, like intelligence scale, Wessler's intelligence scale for children, Stanford Binet intelligence scale. These are the psychological tests commonly used to find out the children's intelligence IQ level. IQ level. Okay, that is IQ. What is the formula for IQ? That is mental age upon chronological age into 100. That mental age can be identified with the help of standard Binet intelligence scale and Wessler's intelligence scales for children. So these are the diagnoses. Now let's see the how to treat mental retardation. Mental retardation, already I told it is not a disease condition. It is not a disease. It is a condition. Now what? How by behavior therapy? With the help of behavior therapy, we can teach social skill. We can teach the children to learn and perform day-to-day life activities, and environmental supervision. That is, the environment must be free from harm. The child will get easily injured. The child can get any accident easily because of the poor mental and psychomotor development. So environment must be carefully planned for the child living, and child development needs must be monitored regularly. So we must know what kind of things the child is needed. So which milestone will occur in the next few months? That everything we must look out very carefully. And I told you, neurological deficit will be there. The child cannot speak. The child cannot hear. So during the time, language therapy, the language therapist will help the child to teach some kind of sign languages. Family therapy is very, very important because the parents who are having the child with mental retardation, इनको क्या है, इनको stress anxiety में भी ज़्यादा है. So definitely family therapy gives support for the parents of the child with mental retardation. Vocational training देना है. Vocational training means we know that occupational training, the mentally retarded child को some basic activities, day-to-day life activities, some kind of activities like hobbies. These things has to be teach. For that, vocational training is very, very essential. So now let's see how to prevent the mental retardation. So prevention also done in three stages: primary prevention, secondary prevention, tertiary prevention. Better in the child psychiatry, every time mental retardation question we can expect. If mental retardation is not coming, attention deficit hyperactivity disorder may come. So give importance for mental retardation first. Now let's see the what is the primary prevention. So primary prevention is genetic counseling, adequate diet with protein, calories, and good minerals, vitamins, and proper family counseling. Like family planning must be done in correct time, and kind of giving some immunizations. These are comes under primary prevention. So genetic counseling, immunization for maternal rubella and other diseases, adequate maternal nutrition during the time of pregnancy. Mother must get adequate nutrition. Family planning, that is particularly size, spacing, and age of parents. Age of parents, size, spacing are very, very important in the prevention of mental retardation in the children. So these things are done in the pre-conception stage. Now let's see what is the other things like proper antenatal assessment, avoiding the use of alcohol and amino synthesis analysis, and away from the radiation can also prevent the child to develop mental retardation. Now gestation, during gestation period, so prenatal care, fetal monitoring, this already I told you. Avoidance of teratogenic substances. Teratogenic substances matlab taking a harmful medication during the time of pregnancy. Radiation exposure must be avoided. Alcohol usage must be avoided. And fetal analysis by aminosynthesis, fetoscopy, biopsy, ultrasound can be used to identify the problem in earlier stages. Now the next thing is during the time of delivery, delivery must be always conducted by the doctor. Apgar scoring should be done properly. So Apgar score will give whether the child is in the problem or not at the time of birth. Close, close monitoring of the mother and child is very, very important because postnatal causes for mental retardation is common. So after delivery, during mother and child must be observed properly. And if the mother is having RH negative, then what we want to give? We want to give the gamma globulin injection we want to give. If it is not given, then there will be a problem. Erythrocytoblastosis that may occur. And now in the childhood period, the first 6 months, mother should give breastfeeding only for the baby. The next important thing is dietary restriction should be given because metabolic disorder may occur. So eating high protein content or eating very less protein content, or sometimes any lack of amino acid, lack of any amino acids, that may be cause mental retardation. That you must be keeping touch with the diet therapist, nutrition expert, and plan the menu for the mother and baby, and avoid head injury by doing the delivery by the trained experts. Lead poisoning, that also must be avoided in the childhood period. So these are the comes under the primary prevention. Now secondary prevention. So primary prevention is mainly focused to prevent the problem. Secondary prevention is to prevent the complication. So early detection and prevention of preventable disease like phenylketonuria and hypothyroidism. That's why I told thyroid function test should be done properly. And early detection of mental retardation involves like emotional problem and behavioral problem assessment by the child psychiatrist is very, very essential. So by doing this, the mental retardation can be prevented in the child. That is comes under the secondary prevention. Now the tertiary prevention, what will be the main tertiary prevention? Once the disease comes, how we can prevent the further complication? Like we want to give occasional therapy and social support, physical therapy should be given for the child. Rehabilitation should be done. Why we need rehabilitation? To help the child to go for further disability and to provide optimal functioning in the day-to-day life. For that, we are giving the rehabilitation. So these are the tertiary prevention. So now we are going completed with the mental retardation. So now we are going to see the another small condition, specific developmental disorder. That is disorders of psychological development. That is called specific development of speech and language disorder. So this may come in the short answer. So mental retardation is a generalized impairment. Mental retardation and STD का difference क्या है? Mental retardation is the general condition. What do you mean by STD? STD is a specific developmental disorder. Like the child have problem in any one specific area of the day-to-day functioning. Don't confuse STD with mental retardation. Okay. Now let us see. Now let us see the specific developmental disorder. This you might know already. Dyslexia. Dyslexia. Which movie you know? I know dyslexia by the from the movie Tare Zamin Par. I know you all might have seen that movie Tare Zamin Par. So what is the main feature of dyslexia? The child will not develop the talking in the correct time. As a result of that, learning the new words takes time, and the child will be having delay in reading the book and notes. Okay, so all these things, dyslexia, difficulty in learning. Okay, difficulty in learning. The movie, the character, Tare Zamin Par yaad rakho. The next problem is dysarthria. Dysarthria is a disorder of speech. So what will be happening? The child will not have pronunciation. The child not pronounce the words correctly. So another condition is the dysphasia. Dysphasia is difficulty in speaking. So aphasia क्या होता है? That is absence of speech. Absence of, but the child is not the dumb. The child can able to speak, but the words are not coming from the mouth. So these three don't uh, have confusion. This arthria, difficulty in articulation. Dysphasia, difficulty in speaking, the pronunciation. Aphasia, what will be the problem is the words will not come from the mouth. So you can see that difficulty in speaking, difficulty in understanding, difficulty in reading, difficulty in writing. All these things are comes under this group of disorder. The next thing is dyscalculia. Most of us having this problem, calculation difficulty. So our brain does not work when we are working the mathematical subject when we are studying. The brain will not work properly to do the calculation. Even the small calculation like plus minus, we cannot able to do it. That is called dyscalculia. Calculia means calculation. Difficulty in calculation. Next one is dyslalia. Dyslalia क्या होता है? Malformation of or imperfect distribution of nerves. So here uh, the tongue will not do the speech function. As a result of that, the words will not come from the mouth properly. That is, it is a dyslalia is a speech defect. It is caused by malformation of or imperfect distribution of nerves. So nerves, the organs, articulation. So this is about Dyscalculia. So in next class we will see pervasive developmental disorder. So today we have completed mental retardation. Also we have completed the specific developmental disorder. Specific developmental disorder में dysarthria, dysphasia, dyscalculia, dyslexia. These things we have seen today. So if you have any doubt, you can ask. So that I can understand that you have understand this topic without any difficulties. Now the class is open for discussion. Be free to ask doubts. डाउट पूछने के लिए मजा है बेटा. कोई डाउट है पूछ लो. सबको समझ गया?
यस सर.
क्या समझ गया?
जो भी पढ़ाया.
तुमने क्या पढ़ाया? डिस्कैल्कुलिया.
मेंटल रिटार्डेशन.
वेरी गुड, वेरी गुड. डिस्कैल्कुलिया क्या होता है?
सर कैलकुलेशन में डिफिकल्टी, कैलकुलेट नहीं कर पाएंगे.
वेरी गुड. कौन सा मूवी याद रखना है? डिस्लेक्सिया.
तारे जमीन पर.
इनका कैरेक्टर नाम क्या? वो बाय नाम
ईशान
सर.
ईशांत अवस्थी.
अच्छा, मेरे को भूल गया. चलो, वेरी गुड. चाइल्ड साइकेट्री में डेफिनेटली one question will come बेटा. Child psychiatry very easy and interesting. Tomorrow we will see attention deficit hyperactivity disorder and autism. We will see tomorrow. So hope you enjoy this class. We will meet again in next class. Tomorrow किस time आपको class चाहिए बता दो. कौन सा
किसी भी टाइम कर लेना सर.
तो बच्चे
यही टाइम ठीक है सर.
इवनिंग टाइम इज बिजी है. कोमल शर्मा, कोई डाउट है पूछ लो. कोमल शर्मा.
सर इवनिंग टाइम सही है.
क्या बेटा?
सोनिया
इवनिंग टाइम
सर.
सही है.
मॉर्निंग टाइम सही है.
चलो बेटा.
सर
मॉर्निंग
इस टाइम लेट हो जाता है और भी काम होता है शाम को.
मेरे को भी
मॉर्निंग टाइम नल्ले. सर मॉर्निंग टाइम इज बेस्ट.
वेरी गुड. 10 o'clock
Morning, sir.
है. आप सारे उठोगे 10 o'clock.
सर पीडीए 10:30 सर.
पीडीए की क्लास होती है.
ओके
पीडीए
बेटा.
की क्लास होती है.
मेरे
सर यही टाइम सही है. इस टाइम पे
यही ठीक है सर.
समझ में आ जाता है.
ओके
नहीं सर, इस टाइम पे बहुत काम होता है.
ओके वी विल डिस्कस इन द ग्रुप टाइम. ठीक है.
ओके सर.
ओके सर.
टेक केयर.